Vermont's Blueprint for Health is a statewide public-private initiative that seeks to provide the incentives and the infrastructure to support the delivery of coordinated, high-quality health services.
Okay, so I saw you, I think, about a month ago.
The Blueprint is hoping to help Vermont achieve the triple aims. And the triple aims really include improving the health of the population, improving control over healthcare costs, and improving the patient's experience of care.
To accomplish these goals, the Blueprint creates a comprehensive approach that addresses some of the most fundamental components and drivers of healthcare.
The design principles are to have high-quality primary care for all citizens, to have the support, the multidisciplinary type of support that many citizens need, to really link community services with healthcare, to take away the silos, and to really bridge more comprehensive health and human services.
The first step was to make fundamental changes to the delivery of primary care.
When you look at the primary care physician's schedule any given day, they have usually a 10 to 15-minute block to see a patient. When you're dealing with someone with often multiple chronic diseases, sometimes financial issues, housing issues, to think that you can handle that in a 15-minute visit is ridiculous.
Prior to the Blueprint, what our doctors would talk about was that doorknob moment. When they were just about to leave the room, they were really afraid to say to the patient, is there anything else I can help you with? Because they didn't have the time to help, they didn't have the resources to help.
Primary care providers, when asked to identify one of the gaping needs that they have, consistently talk about the need for more access to mental health services, substance abuse treatment services, and also assistance with helping to change the health behaviors of the patients that they see.
John, how are you?
So John came to me as a new patient, and I remember, because this happens all the time with patients, that he says he has a touch of diabetes or may have a little sugar, but looking back in the record, it seemed like he did have diabetes. So at the very first visit, I drew some labs, one of which was the hemoglobin A1C. It came back at 8.5.
Dr. Hebert was telling me, I'm going to have to put you on this medication called metformin, and then you might have to take insulin, and we got to kind of make a decision here.
John wanted to avoid being put on diabetes medication, but he had never been successful at making lifestyle changes before.
That's me with like 3 extra chins. I probably weighed about 250 to 260 pounds. I would go through spurts where I would be able to lose weight. That would be by diet and cutting back on stuff. I've lost 20 pounds, and all of a sudden, boom. In 2 months, that 20 pounds is back on, and maybe it's 30.
Fortunately for John, the Blueprint model provides doctors with access to multidisciplinary community health teams to provide the necessary health education and supports that patients need.
We use 3 different screenings. We use one for anxiety, one for depression, and one for alcohol use. So when I first met with John, it became apparent that he was suffering from some depression and was using alcohol more than a normal amount.
I hurt my back working in produce, and basically I have 3 herniated discs. I have degenerative disc disease, and I am on full-time disability.
We definitely talked a lot about how his depression and his alcohol use was affecting his nutrition, quality of life, and his diabetes. So about a piece of bread this size is what we would consider 1 carbohydrate serving.
She got me involved in making the decision instead of just telling me, you have to do this. Emily's always like, do you think you could get yourself to the pool 2 days a week? Do you think you might be able to eat wheat bread instead of white bread, which is so much better for you?
After our first meeting, John decided he was going to start focusing on identifying his carbohydrate portions, and he also resolved to get back into the pool at least twice a week for 20 minutes.
I was probably not sure that John would make those changes. You know, he's a middle-aged man and hasn't made too many changes for most of his life. I didn't know if he'd be able to make those.
What she's done is helped me organize, to really come up with a plan. It made it more well-rounded. It made it easier to follow.
I think once he started working with the dietitian and making a few changes, he felt a lot better, too.
I think I've dropped somewhere between 36 and 40 pounds. I'm going to the pool on the average 6 out of 7 days a week. I'm getting a lot of feedback, just positive feedback about how you look great. I don't feel like I'm done yet. I'd like to lose another 20 pounds on top of the about 40 that I've lost. I'm very happy. I feel healthy.
And that's what really keeps people going, is knowing that they have the confidence and the abilities to keep doing it every day.
Becoming involved with the community health team, the Blueprint for Health, has definitely benefited my practice over the last year that we've done it, and I think it's better for patient care.